It seems a little unclear whether or not kids are really affected by the coronavirus. So we brought in U of U Health and Primary Children's Hospital pediatric rheumatologist, Dr. Erin Tremarchi. Thank you for joining us.
Thank you so much for having me today.
Thank you. Now, this is part of our Healthy in Utah series with the Governor's Office of Economic Development. And Dr. Tremarchi, are there a lot of kids who are testing positive for COVID-19 right now?
Yes, so we have seen a significant increase in the percentage of children who are testing positive across the country. The latest numbers from the American Academy of Pediatrics put it at 11% of total COVID-19 cases. What that really means is we have over 1 million children in the United States who have tested positive for COVID-19.
Okay, so a lot of people are getting it right now. Children are not exempt from that. Still, we're seeing kind of mild symptoms for them. They usually get better, but if they don't, I think the consequences are severe, you're finding.
Yes, so about 40% of children who test positive for COVID-19 do generally do well and have mild symptoms. But we are seeing a small percentage of children who develop something called MISC. It stands for Multisystem Inflammatory Syndrome in children with COVID-19. And these are children who get very sick with high fevers, stomach aches, vomiting, rashes, red eyes, low blood pressure, and end up requiring intensive care unit care in many cases.
So have the hospitals you work at, have they seen some of these cases in person?
Yes, so we have children who are admitted with acute COVID-19 infections, but we have seen at Primary Children's Hospital at least 20 children with this more severe complication, MISC.
Well, thank you for telling us about this. What's something that we can do besides just being aware to help the kids out? Because we're responsible for them as adults.
Right. And I think what we were hearing about wearing masks consistently, physically distancing, avoiding large crowds, and trying to minimize contact without other households is very important. Because when COVID-19 gets in a household, it can very quickly spread between members of the household. So even though a child...
Definitely what happened in my house with me and my son. So, yep, I'm here to say that's true. So, yes, continue.
Yeah, so just being safe and wearing your mask are very, very important.
Okay, well, thank you so much for bringing this to our attention. And if we want to go find out more, where do we go, Dr. Tremarchi?
Yes, you can find additional information at intermountain.org.
Thank you so much.
Intermountainhealthcare.org.
Intermountainhealthcare.org. Thank you so much.
Thank you.